Before we start this podcast, we have a quick disclaimer. This podcast is for educational purposes only. It is not intended as medical advice and should not be used to treat or diagnose. Please ensure you consult with your health practitioner before making any changes to your lifestyle or medical regime. Please enjoy.
Medicinal cannabis is a therapy that has gathered much attention in recent years. Although it's been around for thousands of years, the lack of robust research and its use as a recreational drug have hampered its move to become a credible, legitimate treatment option. At Nourish, we are often asked our opinion on the cannabis as medication debate. Given our preference for natural therapies and lifestyle, ahead of expecting a magic pill to cure everything, we thought we'd wade into the debate, and who better to have a chat with than our own Dunsborough-based GP, Dr. Matty Moore.
Hey.
As a GP, Matty is open to alternative treatment for a number of chronic health conditions and often prescribes medicinal cannabis to some of his patients. Hailing from the US, where a number of states have moved to legalise medicinal use, we trust he has some valuable insights and experiences to share with us. Welcome, Matty, to the podcast.
Hi there. Thanks for having me. I'm really excited to be here.
So am I. I'm really looking forward to getting to know exactly or everything I should know, because I'm sure there's lots to know. But first of all, let's find out a bit more about yourself.
Sure.
You know, you used to work in emergency medicine, and now you've ended up pretty much treating chronic diseases. How have you made that transition, and what pulled you in that direction?
Yeah, I still work in emergency casually. I think it's important that I keep my skill set going. I have an interest in that. You know, I trained in a rural program back home in Wyoming, and with special interest in emergency. So I did a lot more work than my mates in emergency. So that was an interest of mine, and continued to do that. It was my stepping off job in Australia as an emergency registrar, and I got an extra certificate with that with the Australo-Asian College of Emergency Medicine, and have still been a GP at the same time. So I think when medicinal cannabis started, drawing favor here in Australia, and in 2016 it was legal to prescribe it. You know, I had been keeping tabs on it back home, of course. You know, and when I left in 2011, it was really gaining steam. There were several states, including Colorado, obviously one of the first ones, who had legalized medicinal cannabis. And so I had, not only professionally, but also friends who had medicinal cannabis cards for different conditions. So I've always been keeping track of the subject, and always interested in it, and always read about certain studies. And so when it started to be legalized here, then I started really trying to educate myself on how to best get that done for my patients. So it quickly started to be much busier, and so I've transitioned into 5 days a week into chronic illness.
Right.
And a lot of my patients, every week, it's increasing, are medicinal cannabis patients who are looking for other options. So how did I get into chronic illness is really a part of general practice, and we're experts on all of that. And that was a natural segue into treating those chronic conditions with an alternative therapy.
Sure.
So,
do you think your experience in emergency, where you would see a lot of patients who have opioid issues, has opened? Was that a way of leading into the cannabis
Sure.
thing as an alternative?
Sure. We see lots of opioid dependency in general practice too, and there's a great epidemic really in the States, and starting to be in Australia as well. So yes, it's a huge concern, because of the dependency and the abuse. So the alternative with cannabis has really opened the door for people to get off of those medications, and which is a great pleasure and passion of mine.
So you've seen that in your practice,
I
and you
have
have
seen
been
it,
able
and I've
to
been
do
able to help people get off of opioids with cannabis. Cannabis makes it much easier to do so.
in preference to taking them off with other, current conventional therapies.
Well, you have to keep in mind that we have to control their pain.
Yes.
At the same time, as well as help them with those withdrawal symptoms. And those that have been on opiates for a long time are definitely going to get those. So cannabis has eased that for people and helped them get off it much quicker, and also at the same time controlling their pain. So it's been awesome.
It's been
extremely rewarding and people are proud of themselves. And they want to get off those. They know the dependency level, and it's just something that escalates, as you see as a pharmacist. Their doses escalate over their lifetime.
And this is slightly off topic, but a lot of people with opioid dependencies, everyone thinks of the typical person with an opioid dependency as a heroin addict, or something like that, or an illicit, drug user. But a lot of them end up with an addiction because of a injury or a car accident or something like that. So there are often legitimate reasons that people are put onto opioids and have ended up with having,
and they don't have an alternative, so they're really stuck with it. And it's they come out of hospital on them, and they many have tried to get off of them and can't. And so, it's been really, really helpful.
So is that the main area of your practice now, pain management, or do you see
70 to 80% of our prescriptions Australia-wide are for chronic pain with medicinal cannabis. So, they did a big look at that last December, and they've done so recently. And I think the statistics are the same. For chronic pain, we're writing 70 to 80% of our prescriptions generally for medicinal cannabis for that indication. So it's a huge part of what all of us are doing as cannabis prescribers is chronic pain.
And what percentage of people do you manage to get off of? Do they end up taking the cannabis continually or forever? Or is that a transition of medication?
With cannabis, we're treating symptoms, right? We're not curing them. So, I think the best way to do it is if they have a chronic condition like pain, you're going to be treating it for long term. And of the two, I think cannabis is the much safer, much better tolerated without the side effects. So it's relatively benign.
Well, that's interesting because I think the general perception out there as well
the opposite
is the total opposite of that. In that you do find that people kind of go, cannabis, that's so addictive. It's so many side effects. Has so many mental health issues.
Yeah.
Do you want to give us your take on?
I was certainly, as a prescriber and someone whose reputation is very important. That's a given. I didn't want to be known as Dr. Pot at first. Yeah. That was really important to me that I wasn't that guy, and was approached to do this at first, medicinal cannabis, and by my colleagues in the clinic, and then also by some of the cannabis companies to do so. And I was really hesitant at first because I knew the bias, I knew the stigma. However, I tried prescribing it for a few patients at first, and it was life-changing for them. And so that changed my mind immediately. It was like, you know what? I don't really give a rip. This is helping them.
Yes.
I'm going to put my ego and my reputation in check and really help people. And it's been incredible.
So was there one particular case or one particular moment that you remember that you went, okay?
A couple, actually. Yeah. One was an early patient who who had multiple abdominal surgeries, chronic pain because of that, was on opiates, benzos, and Lyrica, and was less and less.
That's a pretty tough
Oh, it's
combination.
a heck of a cocktail, absolutely, and
Yeah.
and was not a very good husband, father, and just person in general anymore. And he was extremely frustrated by that because he just couldn't do what he wanted to do. So he was one that I was able to get off of medications, and now he's much happier, much more positive, and I think he's looking for jobs and back into a normal life, which was amazing. That was my first one. The second one was a little guy, a 9-year-old young boy who had resistant epilepsy and was on many medications. It had a great effect at first, a honeymoon period, and then
course, yeah.
it didn't work anymore. And so their family had sourced Charlotte's Web, which is a 1 in 20 ratio from Canada, and was able to one day go from 150 seizures a day, not meeting his milestones, not talking at age 6, to the next day not having any seizures, and started to meet his milestones like quickly. He started to speak. He told his family he loved them. Like seriously, evoking emotions.
That's
I know.
Me feel...
Seriously, me too.
Yeah.
So that was the second patient that really was extremely positive.
Yes.
And I couldn't go against that tide. So what we did was, we've since sourced medicinal cannabis for them legitimately, and yeah, I mean this kid's meeting milestones, being a normal boy, going to school, talking, socially interacting. So it was a game changer for that family.
How long ago was that?
That was within the year.
Yes. Wow.
And that's a local patient. So
that's amazing. I mean, and certainly as a health practitioner,
that's
what
we do. That's it.
I mean, that kind of like goes.
Yeah, totally. Me too.
Yeah.
It's like every time I think about it or talk about it, it gets me emotional.
Yeah, true. So it sounds like that you have a really different way of dealing with your patients. That you have. How does it differ from the kind of traditional doctor?
Well, shoot, I'm just a regular dude. I just happen to have a decent brain, went to medical school. Otherwise, I'm just like you and the next guy. So I don't consider myself different. I guess ego-wise, I don't know. I really, it's the only thing I ever wanted to do since I was a kid.
Sure.
Was this. And so I've done everything in my whole life to get here, and so therefore it means a lot, and each interaction with people means a lot, So I get a lot out of it. I love what I do. I love the patient relationship, the fact that I get to take care of kids, to see them to adolescents, to adults, and it's soup to nuts medicine, which I love. I don't know. I don't consider myself different, I guess, but I guess I am. When people tell me about...
I think you are. Yeah. Maybe a new breed, a younger breed of medical practitioner.
Well, we got to
the feedback we get is that particularly specialists, but maybe not so much medical practitioners now, the older generation would believe everything that you say, and now you're getting younger people coming in back and saying, I don't trust what you're saying, I'm going to call you out on things and whatever.
The web has changed that a lot for people too.
So people are kind of interacting at a more even level, I guess.
Totally.
And they're not necessarily believing everything you say. So you have to build that rapport with them, I guess, and they won't just automatically believe you. So
the paternalistic doctor-patient relationship, I think, is gone. It should be gone. Whereas, it should be as eye to eye, People can educate themselves, at least not medically, like not to a medical person level, but they can certainly come into an appointment with more
Yes.
knowledge.
Yeah.
And we've got to respect that. And it's so important to listen. So it's a skill that a lot of people don't have. They don't care. They don't have the time. They've got to bill. Where, I'm different, I guess, in that way, that I find myself running late a lot. And I just say to my folks, hey, look, it may be you in here, but I'm actually taking care of this
present.
patient.
You're 100% present.
I'm not looking at my clock.
Yeah, no, that's a very admirable way of, and that's how medicine should be.
Should be.
Really.
100%.
Well done. Do you think when you first started prescribing cannabis to people that there was a stigma from, or is there a stigma from your patients when they tell people that they've been prescribed cannabis?
They do. They still try to hide it, I think. For instance, when they go into hospital and, they present their medication list and their medications, some are very hesitant to tell them that they're on medicinal cannabis. And I tell them the opposite. The only way we're going to get this medicine as a first-line therapy noticed and legitimized is if you're proud of it, if you tell people, hey, this really helps me. I need you to give me this at this time and at this time.
Yes.
So that's the only way that we're going to really change things.
Yeah. Bringing it out into the open, I guess. Yeah.
Absolutely. And as we compile the data, it legitimizes it even more. So that's super important, that people aren't hesitant. They don't hide what they're taking, that they get the word out that, hey, look, it may not work for you. It may not. It may have some of those side effects, but it may be worth giving it a shot if you've run out of options.
Absolutely. And the only thing I'd say is that we're often saying a very similar thing to people in that, if you're going into hospital, don't not tell your doctor that you're taking a herbal supplement, because it may just be the missing piece in when they're trying to diagnose or find out what's going on, or there's an interaction there. So it's great that they're actually being encouraged to admit that they're on it. And hopefully, as you said, with the research, the more that people are actually using cannabis and the more it becomes into the mainstream, the more research we get and the more legitimacy, I guess.
Yeah, and then we can change people's biases, because that bias is has got roots. I mean, when back in the 40s, I think, when Enslinger, who was the drug czar for the Department of Treasury in the States, basically made cannabis illegal, and then everybody else on the planet, went with it. And since then, we haven't used it. It's been a taboo subject.
It's definitely.
And for a lot of our folks, it still remains that. And so we've got to change that, and be bold, and tell people about the indications that we're treating and that is being treated by medicinal cannabis, and get the good message out there. And no, it's not for everyone.
Well, that's actually something I did want to bring up, because it's a bit like everything. There's a fad, like one minute it's avocados, sure. And and in some ways, some people would look at cannabis oil and cannabis therapy as it's a fad that and that you're going to come out here and say that it treats everything, but that's not the case,
no,
is it? It's very specific.
It's not snake oil.
Yes.
Okay. It's good for certain conditions. The conditions that it's okay for, at least to trial it anyways, there's some data backing that, and that's what the TGA's paid attention to and allowed us to use it for that. If there are therapies that haven't worked, medications that haven't worked, or if there's been side effects with the current management plans, and then we can access it.
So it's not a first-line treatment.
It's not an approved medication.
No, yeah, it's something that has to be.
Yeah.
You have to have jumped through a lot of hoops, or you have to have tried a lot of other therapies and had no success.
Yeah, and it's not that you've tried everything else exclusively. It's if you've tried a medication and it's had side effects or it hasn't worked for you, then we're able to apply. So I don't think it's if you've run out of completely of all of the options. I think if you failed on a conventional management therapy and failed, then you can access it.
Which you would expect that as they get more information,
totally,
it
as
may
an
well
unapproved
move.
medication, that makes sense.
Yeah, that makes sense.
Yeah.
One of the other questions I wanted to ask you is, and we do get a lot of people that are concerned, is the driving with taking while they're on medicinal cannabis. What kind of an issue is that, and should we be concerned?
Yeah, look, it's an important topic. And on one hand, we're allowed access to this medication, right? But dinged for it if it's even in our system. Even if folks have taken it for nighttime, and drive in the morning, within a certain time frame, they can pop positive on a swab. And what we tell them is, look, you're not supposed to drive with THC in your system. I still tell people that, they drive at their own risk. It's a real issue, but it's changing. Victorian laws are changing, and hopefully that the trickle down from that will be that other states will alter their regulations on it. But it is real. It's certainly a concern. I think, which leads me to probably a next question. How long do you wait? Well, I think the research shows anywhere from 8 to 12 hours. Okay. So I think your minimum would be 8 hours.
Yes.
Okay. But THC is lipophilic. It attaches to fat. So there's a chance that you could pop positive not only 24 hours, but days afterwards. So it's really dependent on each person, their fat content, how much they exercise, that volume of distribution, right?
Yes, yeah, sure.
The intake of water, that has a big, effect on it. So it's a real issue. Happy to talk to folks about it if they wanted to, but I would still counsel people, not to drive at least 8 hours after they've taken it. Now there's different ratios of cannabis medicine, and with different levels of THC within it. So, the CBD majority oils, I think they could probably get away with 8 hours or less. But with the higher THC content, I think 8 hours at least.
Yeah. So it's something that really has to be personalised to that person. And like you said, specifically, if you've got someone who is very overweight and high fat ratios and things like that compared to a lean triathlete or something like that, then, there would be slightly different recommendations for each one.
It would skew potentially their results on a roadside test.
What about FIFO workers? I mean,
I've got a few FIFO guys on medicinal cannabis, even police officers on cannabis. So for the FIFO guys,
they're often drug tested, aren't they?
They are. They're always drug tested. So what I counsel them is say, look, honesty is your best key, and that's what you need to be focused on, is telling your employer, look, I'm on this medicine. I give them a letter. I tell them why, and if they need to talk to me, with the patient's consent, I'm happy to talk to them about it. And by and large, the companies have altered their policies, and that's come within the last 6 months, I think. So I think I don't think that is a impediment to cannabis medicine for them.
No, well, I think if it's legitimately prescribed, the employer would see it in a different way. But it is important. I think the honesty is the best policy,
Absolutely.
really.
Yeah.
And but it does show you it kind of highlights that there is a stigma.
We've got a long way to go.
Yeah,
we do.
Absolutely. Yeah. A lot of people, I guess, my last question is that a lot of people, that stigma which we see coming up all the time, and the fact that until recently it hasn't been available, a lot of people have headed towards the black market, and they've started to purchase it through friends, family, internet, all of that kind of thing. What's your kind of message for why we shouldn't?
There's a big
possibly,
difference.
Yeah.
There's a big difference in black market oil versus prescribed. Not only in content, okay, because they've done studies on the black market oils. And I'll get you this data if you like, but I think it's about 80% of what they tested, and if 80% or higher, was not what they had said it was. Like they said it was TH free and it has THC in it, or other minor cannabinoids or terpenes or flavonoids that were found that weren't told about. Okay, so there's a big difference. And furthermore, I think that, you with a prescription, exactly what's in it because of that rigorous testing. The heavy metals are removed, the pesticides are removed. We know exactly what percentages of cannabinoids are in it, what terpenes are in it, how much of those terpenes, how much of the flavonoids are in there. So it's consistent. And it's bottled such. And you would expect that from a medicine.
And that the dose that you take one day and the next bottle that you get will have the same dose and therefore the same effect.
Yep.
Yeah.
And you run the risk of, if you get caught with a black market oil, getting in trouble, whereas with a letter from me or they know that it's legitimate prescription, that you might get a pass there. But it's dangerous. It's not the same stuff, there are oils that are black market that have way more THC than they should. And for some people, that can tip them over the edge. That can make their PTSD or anxiety worse with that higher THC. With CBD, it negates a lot of that negative properties of THC. So the CBD is and the THC ratios are very important to know.
Yeah,
certainly for specific conditions.
Yeah, so certainly for listeners, there are ratios where you can get CBD oil on its own, and then you can get CBD oil with some THC, and that increases. But and different strengths, I guess, are prescribed for different conditions. But one of the things that you did say was that the THC, if you have underlying mental health issues, that can make things worse. And so therefore it shouldn't be something that is chosen by, through mail order, or it needs a medical practitioner to kind of assess.
I can totally respect the financial burden of cannabis as it is right now, and going the avenue of black market because it's cheaper, but it's a real risk. And prices are going to come down. They're coming down this year.
They will.
So I think it's very important that patients know that black market is very different than medicinal.
On a positive note, I believe that some of the because the cost is prohibitive, people do look at us and go,
whoa,
they take a deep breath, and it's not the pharmacy cost, it's the actual medicine cost.
Absolutely.
But apparently some of the insurers are now starting to come to the party.
There's a big player, HIF, which has started to subsidize cannabis medicine, and Little Green Pharma has a special deal with them, and they rebate for their medicines even more. What the trickle down of that will be other insurance companies will come to the table, will do that for their patients because they have to. It's competition. It's a free market. And you got one insurance company that does it and others not. People are going to move to that insurance company. It's going to happen. So I think that is a huge game changer for our patients who need medicinal cannabis and can't afford it
at the moment. Sure. On that positive note, because I'm very conscious of time, we see that has just
That was fast.
That has absolutely flown
So
by.
fast.
We've covered so much, and the time has just flown. Many thanks, Matty.
You're welcome.
For enlightening us with your knowledge and your expertise.
No worries.
It was great to get your insights into this controversial area. What we will do is put links to Matty's Facebook and Instagram. And also, if you have any questions that you want to come into the pharmacy and ask us about or make an appointment, we'll put all the details at the end of the podcast. Hope you enjoyed it. I did. Thanks.
Thanks so much.
Yeah.
It was great.